disorder can help you manage your symptoms and control mood swings. Understanding bipolar disorder treatment. If you suspect that you're suffering from bipolar disorder, it's important to seek help right away. Bipolar disorder is a lifelong condition that runs an unpredictable course of ups and downs. When left untreated, these ups and downs can be devastating. The recurring manic and depressive episodes that characterize the disease make it difficult to lead a stable, productive life. In the manic phase, you may be hyperactive and irresponsible. In the depressive phase, it may be difficult to do anything at all. Early diagnosis and treatment can help you avoid these problems. An experienced mental health professional can make an accurate diagnosis and start you on the path to recovery. Successful treatment of bipolar disorder depends on a combination of factors. Medication alone is not enough. In order to get the most out of treatment, it's important to educate yourself about the illness, communicate with your doctors and therapists, have a strong support system, and help yourself by making healthy lifestyle choices that may reduce your need for medication. It's important to stick to your treatment plan, reassessing with your doctor as changes in your life occur. Recovering from bipolar disorder doesn't happen overnight. As with the mood swings of bipolar disorder, treatment has its own ups and downs. Finding the right treatments takes time and setbacks happen. But with careful management and a commitment to getting better, you can get your symptoms under control and live life to the fullest. Getting an accurate diagnosis. Getting an accurate diagnosis is the first step in your bipolar disorder treatment. And it isn't always easy. The mood swings of bipolar disorder can be difficult to distinguish from other problems such as major depression, ADHD, and borderline personality disorder. For many people with bipolar disorder, it takes time and numerous doctor visits before the problem is correctly identified and treated. Making the diagnosis of bipolar disorder can be tricky even for trained professionals, so it's best to see a psychiatrist with experience treating bipolar disorder rather than a family doctor or another type of physician. A psychiatrist specializes in mental health and is more likely to know about the latest research and treatment options. What to expect during the diagnostic exam. A diagnostic exam for bipolar disorder generally consists of the following: psychological evaluation. The doctor or bipolar disorder specialist will conduct a complete psychiatric history. You will answer questions about your symptoms, the history of the problem, any treatment you've previously received, and your family history of mood disorders. Medical history and physical. There are no lab tests for identifying bipolar disorder, but your doctor should conduct a medical history and physical exam in order to rule out illnesses or medications that might be causing your symptoms. Screening for thyroid disorders is particularly important, as thyroid problems can cause mood swings that mimic bipolar disorder. In addition to taking your psychiatric and medical history, your doctor may also talk to family members and friends about your moods and behaviors. Often, those close to you are able to give a more accurate and objective picture of your symptoms. Getting an accurate diagnosis. Getting an accurate diagnosis is the first step in your bipolar disorder treatment. And it isn't always easy. The mood swings of bipolar disorder can be difficult to distinguish from other problems such as major depression, ADHD, and borderline personality disorder. For many people with bipolar disorder, it takes time and numerous doctor visits before the problem is correctly identified and treated. Making the diagnosis of bipolar disorder can be tricky even for trained professionals, so it's best to see a psychiatrist with experience treating bipolar disorder rather than a family doctor or another type of physician. A psychiatrist specializes in mental health and is more likely to know about the latest research and treatment options. What to expect during the diagnostic exam. A diagnostic exam for bipolar disorder generally consists of the following: psychological evaluation. The doctor or bipolar disorder specialist will conduct a complete psychiatric history. You will answer questions about your symptoms, the history of the problem, any treatment you've previously received, and your family history of mood disorders. Medical history and physical. There are no lab tests for identifying bipolar disorder, but your doctor should conduct a medical history and physical exam in order to rule out illnesses or medications that might be causing your symptoms. Screening for thyroid disorders is particularly important, as thyroid problems can cause mood swings that mimic bipolar disorder. In addition to taking your psychiatric and medical history, your doctor may also talk to family members and friends about your moods and behaviors. Often, those close to you are able to give a more accurate and objective picture of your symptoms. Exploring bipolar disorder treatment options. If your doctor determines that you have bipolar disorder, he or she will explain your treatment options and possibly prescribe medication for you to take. You may also be referred to another mental health professional, such as a psychologist, counselor, or a bipolar disorder specialist. Together, you will work with your healthcare providers to develop a personalized treatment plan. Comprehensive treatment for bipolar disorder. A comprehensive treatment plan for bipolar disorder aims to relieve symptoms, restore your ability to function, fix problems the illness has caused at home and at work, and reduce the likelihood of recurrence. A comprehensive bipolar treatment plan involves medication. Medication is the cornerstone of bipolar disorder treatment. Taking a mood-stabilizing medication can help minimize the highs and lows of bipolar disorder and keep symptoms under control. Psychotherapy. Therapy is essential for dealing with bipolar disorder and the problems it has caused in your life. Working with a therapist, you can learn how to cope with difficult or uncomfortable feelings, repair your relationships, manage stress, and regulate your mood. Education. Managing symptoms and preventing complications begins with a thorough knowledge of your illness. The more you and your loved ones know about bipolar disorder, the better able you'll be able to avoid problems and deal with setbacks. Lifestyle management. By carefully regulating your lifestyle, you can keep symptoms and mood episodes to a minimum. This involves maintaining a regular sleep schedule, avoiding alcohol and drugs, eating a mood-boosting diet, following a consistent exercise program, minimizing stress, and keeping your sunlight exposure stable year-round. Support. Living with bipolar disorder can be challenging, and having a solid support system in place can make all the difference in your outlook and motivation. Participating in a bipolar disorder support group gives you the opportunity to share your experiences and learn from others who know what you're going through. The support of friends and family is also invaluable. Reaching out to people who love you won't mean you're a burden to others. Medication treatment for bipolar disorder. Most people with bipolar disorder need medication in order to keep their symptoms under control. When medication is continued on a long-term basis, it can reduce the frequency and severity of bipolar mood episodes and sometimes prevent them entirely. If you have been diagnosed with bipolar disorder, you and your doctor will work together to find the right drug or combination of drugs for your needs. Because everyone responds to medication differently, you may have to try several different medications before you find one that relieves your symptoms. Check in frequently with your doctor. It's important to have regular blood tests to make sure that your medication levels are in the therapeutic range. Getting the dose right is a delicate balancing act. Close monitoring by your doctor will help keep you safe and symptom-free. Continue taking your medication, even if your mood is stable. Don't stop taking your medication as soon as you start to feel better. Most people need to take medication long-term in order to avoid relapse. Don't expect medication to fix all your problems. Bipolar disorder medication can help reduce the symptoms of mania and depression, but in order to feel your best, it's important to lead a lifestyle that supports wellness. This includes surrounding yourself with supportive people, getting therapy, and getting plenty of rest. Be extremely cautious with antidepressants. Research shows that antidepressants are not particularly effective in the treatment of bipolar depression. Furthermore, they can trigger mania or cause rapid cycling between depression and mania in people with bipolar disorder. The importance of therapy for bipolar disorder. Research indicates that people who take medications for bipolar disorder are more likely to get better faster and stay well if they also receive therapy. Therapy can teach you how to deal with problems your symptoms are causing, including relationship, work, and self-esteem issues. Therapy will also address any other problems you're struggling with, such as substance abuse or anxiety. 3 types of therapy are especially helpful in the treatment of bipolar disorder: cognitive behavioral therapy, interpersonal and social rhythm therapy, family-focused therapy. Cognitive behavioral therapy. In cognitive behavioral therapy (CBT), examine how your thoughts affect your emotions. You also learn how to change negative thinking patterns and behaviors into more positive ways of responding. For bipolar disorder, the focus is on managing symptoms, avoiding triggers for relapse, and problem solving. Interpersonal and social rhythm therapy. Interpersonal therapy focuses on current relationship issues and helps you improve the way you relate to the important people in your life. By addressing and solving interpersonal problems, this type of therapy reduces stress in your life. Since stress is a trigger for bipolar disorder, this relationship-oriented approach can help reduce mood cycling. Social rhythm therapy is often combined with interpersonal therapy social rhythm therapy for the treatment of bipolar disorder. People with bipolar disorder are believed to have overly sensitive biological clocks, the internal timekeepers that regulate circadian rhythms. This clock is easily thrown off by disruptions in your daily pattern of activity, also known as your social rhythms. Social rhythm therapy focuses on stabilizing social rhythms such as sleeping, eating, and exercising. When these rhythms are stable, the biological rhythms that regulate mood remain stable too. Family-focused therapy. Living with a person who has bipolar disorder can be difficult, causing strain in family and marital relationships. Family-focused therapy addresses these issues and works to restore a healthy and supportive home environment. Educating family members about the disease and how to cope with its symptoms is a major component of treatment. Working through problems in the home and improving communication is also a focus of treatment. Complementary treatments for bipolar disorder. Most alternative treatments for bipolar disorder are really complementary treatments, meaning they should be used in conjunction with medication, therapy, and lifestyle changes. Here are a few of the options that show promise: light and dark therapy, like social rhythm therapy. Light and dark therapy focuses on the sensitive biological clock in people with bipolar disorder. This easily disrupted clock throws off sleep-wake cycles, a disturbance that can trigger symptoms of mania and depression. Light and dark therapy regulates these biological rhythms and thus reduces mood cycling by carefully managing your exposure to light. The major component of this therapy involves creating an environment of regular darkness by restricting artificial light for 10 hours every night. Mindfulness meditation. Research has shown that mindfulness-based cognitive therapy and meditation help fight and prevent depression, anger, agitation, and anxiety. The mindfulness approach uses meditation, yoga, and breathing exercises to focus awareness on the present moment and break negative thinking patterns. Acupuncture. Some researchers believe that acupuncture may help people with bipolar disorder by modulating their stress response. Studies on acupuncture for depression have shown a reduction in symptoms, and there is increasing evidence that acupuncture